السلام عليكم ورحمة الله وبركاته. Thank you very much for the Dr. Mariam, Dr. Muhammad. يعطيكم العافية, جزاكم الله خير. My name is Dr. Issa Faqih from King Fahd Medical City. I'm a head section medical genetics. My question directed to Dr. Mariam. It was fascinating that you presented the tip of the iceberg that we have and encountered the medical genetics in the field of MOH in general. My question, do you come up with something like, I would say, like scope of the common diseases that we have we harbor in the Saudi Arabia, and probably in connection with the Saudi Genome projects that you might connect it to somewhat with that center? Thank you.
Regarding the Saudi Genome Project, we don't have enough data from my side. The research that we did with the National Guard with Dr. Al-Fadl, thank you, Professor Al-Fadl. I would say the data that obtained from them, it is not representative for the Saudi population, but this is the best that we could get from there. It will give us a clue, but it's not going to cover all the regions in Saudi Arabia, unfortunately.
Yes, Bismillah ar-Rahman ar-Rahim. Thank you very much for the speakers. Dr. Mahazza, my question is, in your initiation, was there any really that some patients, they were not improving with the disease and you have to stop it? And the other thing, do you think that you can expand this initiation and you can just not to include only SMA like Duchenne muscular and other enzyme replacement or other with the pharmacy and the MOH to include other rare disease and expensive medication?
Sorry, thank you. For the first question, I think when the committee started, there were some patients who already were in therapy. So we studied those groups. So yes, we found patients who really did not respond appropriately to the therapy. And most of those are those who are, they have advanced disease and mechanical ventilation, very weak, and those usually did not achieve a good outcome. Now, for expansion, I'll leave this to the Ministry of Health because that's their decision.
Hi, thank you for the presentations. My name is Kendrick Spiegel. I'm the CEO of VivaMed. Could you talk a little bit, in rare diseases, for obvious reasons, there is kind of a disproportionate focus on pharmacotherapies. Could you talk a little bit more about the role of physiotherapy interventions in improving the quality of life and how you see the integration of physiotherapy into a center of excellence for rare genetic disorders research and treatment?
Yeah. All right. For SMA, I think physiotherapy is a cornerstone in this disease management, both improving posture, range of movement, prevention of joint contractures, prevention of scoliosis, and ensuring a better mobility because, the physiotherapy for a patient who is a non-sitter is different from the patient who is sitter and is different from a patient who is ambulant. So number one. Number two, for the assessment, the standard tools that are used now as part of the, either in clinical trial world of SMA or in outcome assessment includes physiotherapy tools like the Heine, the Chopinton, the Hammersmith Functional Motor Scale Expanded, Revised Upper Limb. And all these tools, they aim to assist the ability to perform a certain task. And what we learned from clinical trials and real-world evidence that if a patient achieves this level of score in such a given score, he's most likely going to improve by this number of points after therapy. So that gave us an idea of what to expect from therapy. And also it gave us, it helps us in knowing the trajectory for each patient from the get-go of program entry. The other, this is as part of the assessment. As part of the intervention is, as I mentioned, improving the range of movement, preventing joint contractures, and improving spine and skeletal, the skeleton of the patient is very important. One of the things that we found in our cross-sectional study is that there is a great deficiency on the physiotherapy assessment and follow-up of those patients. I hope I answered the question.